Hi everyone, today we will be discussing about normal CT nephrogram. It consists of unenhanced phase, and once the contrast is given, we have three phases. There is a corticomedullary, nephrographic and excretory. Next is the corticomedullary phase. Once the contrast is given, it begins 20 to 60 seconds after the contrast is given. The contrast passes from aorta into the renal artery, from there into the renal cortex. This is like spine. This is both kidneys. You have an aorta, you have an IVC. This is the cortex and this is the medulla. Once the contrast passes to the renal arteries into the cortex, the renal cortex enhances. Here the medullary kidney is less minimally enhancing, and this is the corticomedullary phase. And this is best to evaluate the vascular. Next we have the nephrographic phase. Once the contrast is given, it begins 80 to 120 seconds after the contrast injection. Now the contrast it passes into the medullary collecting ducts. Here we have an aorta, we have an IVC. Here we have a spine and both kidneys. And the contrast it passes into the medullary collecting ducts, and the medulla also enhances. Here there is homogeneous enhancement of the renal medulla and cortex. This is the phase most important for distinguishing renal masses. That is the nephrographic phase. So 80 to 120 seconds after contrast injection, both renal medulla and the cortex, they enhance homogeneously. It's best phase to distinguish renal masses. So next is the excretory, pylographic or urographic phase. Once the contrast is given, it begins about 180 seconds. That is 3 minutes after the contrast is given. Here we have aorta, IVC, spine and both kidneys. Here the contrast is get excreted into the renal pelvis. Here the renal pelvis. There is progressive decrease in the nephrogram, and this is best phase to evaluate the collecting system, like major and minor calyces, renal pelvis, ureter and bladder. Thank you.